Hey guys, welcome to my YouTube channel again. For a good 4 to 5 decades, medical fraternity considered viral and fungal infections as less severe and less frequent infections. Well, the tables have turned now. Or as Michael Scott would say, well, how the turntable. While we are all scared about the rising cases of mucormycosis or black fungus, there is a new enemy around that has been named white fungus, the scientific name of which is Candida. They say that the world is not black and white, there are lots of shades of grey. Well, these two fungus has made our lives more grey than they have ever been. Let us see what are the differences between these two fungus. The scientific name of white fungus is Candida albicans and the black fungus is Mucormycetes. Why are they named so? Because of the colony color when they are grown on a culture media. White fungus forms white colonies, whereas black fungus tend to form black colonies. Where are they found? White fungus are said to be ubiquitous. They are even found in your oral cavity and gut and lung secretions. Black fungus are ubiquitous in nature. They are found in the compost piles, fruits, vegetables, bread, etc. The susceptible population for any fungal infection will be those who are immunocompromised. The diseases that are caused by the white fungus include the infection in the oral cavity, skin, nails, your gut, lungs, brain, and disseminated form of infection where it involves multiple organs. Black fungus causes rhinocerebral infection, of which we have seen terrifying pictures, pulmonary disease, and disseminated disease that is spread throughout the body. What about the fatality rate? White fungus appears to be less fatal than the black fungus, which has high fatality rates, and the white fungus fatality depends upon the site of infection, disseminated infection being the most severe infection. Now, what is this white fungus? White fungus, also known as Candida, are small, oval, thin-walled yeast-like fungi, as has been shown here, and when grown on a culture media, Candida species form smooth, creamy white, glistening colonies as has been shown here. There are about 200 species of Candida, out of which only 17 species are infecting to humans, and out of the 17, 5 of these Candida species are responsible for more than 90% of the invasive disease that has been seen in the humans, out of which Candida albicans is considered to be a prototype of the Candida species. Now, this Candida can be seen in three phases, that is pseudohyphae, yeast, and hyphae. Yeast cells may be disseminated more effectively and hence are responsible for spreading of the disease maybe some from person to person, whereas hyphae are thought to promote invasion of epithelial and endothelial tissue. And how this hyphae cause the invasion is that these hyphae at the tip consists of phospholipases. Phospholipids, being the constituent of your cell wall, are being lysed by the phospholipases, and hence this fungi is responsible for the invasive infection. Coming to the epidemiology of the Candida species, they remain the fourth leading cause of nosocomial bloodstream infections in United States, accounting for 8 to 10% of all nosocomial bloodstream infection. Imagine a country like India where the hospitals are utterly unclean. What would be the incidence of Candida infection? It is expected to be very high. Now, where are these Candida fungus seen? These Candida fungus have been isolated from hospital environments, countertops of the hospitals, AC air vents in the hospitals, and from the hands of the medical personnel. What are the risk factors for the Candida bloodstream infection or invasive disease? Systemic antibiotics, unrational use, unmonitored use of antibiotics makes a person susceptible for Candida infection. Chemotherapy given in the patients of cancer. Corticosteroids, again, these steroids like methylprednisolone and dexamethasone have been used extensively in COVID patients, and they are at the risk of acquiring Candida infection. Presence of intravascular catheters in those patients who have been admitted in ICU are at risk. Recent abdominal surgery, as already been told, Candida is found in the gut of human beings, and thus any surgery can predispose a person for Candida infection. Hospitalization in ICUs, because the Candida can grow pretty much everywhere, ICUs being critical points where Candida infection can spread. Malignancy, neutropenia, and prior fungal colonization are some of the risk factors. Now, how do these Candida infections present? These infections, when occur in oral cavity, present as whitish patches in the oral cavity with painful mouth burning and dysphagia, which is difficulty in swallowing. It has been found to be infecting those people who use ill-fitting dentures, especially infecting the upper part of the oral cavity, and they can also present with the infections of angle of the mouth. These infections are not controlled, they may spread into the esophagus or food pipe. And now the presentation would be with odynophagia, that is painful swallowing, dysphagia, difficulty in swallowing, and retrosternal pain, that is pain behind your chest. And these patients can also have fever and malaise. Now, seen typically in patients with prolonged immersion of extremities in water in some professions, and diabetes mellitus patients tend to have Candida infection of skin and nails, as been shown. The skin infection, as we can see, occur in those areas where there is more sweating and they appear reddish, and the nail infection can cause brittle nails and easy breakage of nails. Now, the most talked infection of Candida is infection of the lungs. This has been found to occur as two types. One that is involving particular part of the lung, and the other that spreads throughout the lung, and hence giving appearance that has also been seen in the CT scans of COVID patients. Now, this pulmonary infection caused by Candida albicans tend to mimic clinically as well as radiologically to the COVID infection, and that is what has made into the news. Now, you might have learned that the Candida infection is more common in ladies because of its propensity to cause vulvovaginal infections. Now, the patients will have pain abdomen, whitish discharge from the vagina, and this is how the growth of Candida is seen when used with the vaginal speculum. Now, the most important question is invasive candidiasis contagious? That is, the bloodstream infection or the disseminated infection of the body, is it contagious? This is what CDC website says. Invasive candidiasis doesn't spread directly from person to person. However, some species of the fungus that cause infective candidiasis normally live on skin. So it's possible that Candida can be passed from one person to another and possibly cause an infection in someone who is at high risk. So can it be contagious? Definitely yes. What are the do's in Candida infection? Control hyperglycemia. If you are a known diabetic patient, Your sugar levels should be monitored and controlled with the required drugs or insulin. Monitor glucose level post COVID-19 discharge and also in diabetics. If you are admitted to a hospital because of COVID, make sure to get your sugars done. And if you are a diabetic, the sugar has to be controlled. Use steroid judiciously, has been emphasized a lot more. Correct timing, correct dose, and correct duration has to be taken as directed by the doctor. Use clean, sterile water for humidifiers during oxygen therapy. Hospitals as well as home-based care has to keep in mind that the oxygen therapy either in the hospital or in the home with the oxygen concentrator, you have to use clean, sterile water because any moist environment is a good culture media for the fungus to grow. Use antibiotics and antifungals judiciously, and CDC website tells you to be a safe patient. There are some actions that you can take yourself to protect from the fungal infection. They tell you to speak up. Patient and caregivers can ask whether a central venous catheter is needed or not, because these central venous catheters act as a source of the fungal infection. Keep hands clean. Be sure everyone cleans their hands before touching you if you are a patient. Washing hands can prevent spread of a lot of germs, not just the fungal infection. Now, once you have the symptoms of disease, how the diagnosis is made. Growing Candida in the petri dish is a huge challenge because isolation of Candida from non-sterile sites such as wounds, skin, urine, sputum, vaginal secretions, and stool is not diagnostic of Candida, and Candida is considered a nuisance and it can grow pretty much everywhere. And thus, while investigating for other diseases, other blood infections, Candida growth can happen, and this does not point towards the Candida infection. But if you can grow Candida from the sterile sites such as blood, CSF, pleural fluid, and your abdominal fluid, these are indicative of infection and requires treatment. Now, what is the fatality rate with the Candidal infection? In those with the disseminated disease, the mortality has been found to be ranging from 40 to 60%, ballparking 50%. That is, half of the patient with a disseminated infection that has spread throughout the body will die with or without treatment. So what is the best way to protect yourself from these fungal infections? Well, protect yourself from COVID infection. And one of the most important steps has been shown here to wear your mask correctly. Do not forget to subscribe. Your subscription makes me come up with more videos like this.